It's election day here in the United States, and the results aren't in, so it's hard to know where things will be tomorrow, or if we'll even know after that. I may be moving either to Canada or Australia, depending on how things go. But getting back to the topic, welcome to the Advanced Techniques section for device implantation being held at the third scientific sessions of the Latin American Heart Rhythm Society. It's actually the first virtual version of the scientific sessions. When we say advanced techniques, we are essentially talking about process optimization and the use of interventional tools and techniques to overcome obstacles to successful device implantation, rather than just clearing defeat and sending the patient to surgery or saying they have to live with their heart failure. Unfortunately, at most EP training centers, the main emphasis is on ablation. And in some centers, there's not a lot of device referred in. So the interventional approach to device implantation frequently isn't discussed or dealt with in the ET training situation. However, when a fellow goes out into the real world, ablation is only a small part of the actual business, and a large part of it will turn out to be devices. So it's very helpful to feel confident about devices when you get out into the real world. So to that end, we'll have a lot to cover. So we have two full sessions. The first session will cover the basics, including room setup, table position, and that session will be followed by how to use a telescopic system to reduce implant time and improve lead placement. From there, we'll discuss the use of snares for LV lead implantation. Now, using snares is the most powerful technique for LV lead implantation. So once you get the snare down, there's almost nothing that you can't implant. Finally, in the first session, we'll learn how to cross a subclavian occlusion and perform venoplasty for venous access. You can't do any of this if you don't have venous access, and anything is much more difficult if you don't have a good venous access, and that's where venoplasty comes in. It makes it possible to move catheters much more easily. After a break, we'll begin session 2 with a few words from our chairman, and then we will discuss how to use coronary balloons as anchors for difficult CS cannulation and or to get the subselector deep into the target vein when it has a lot of tortuosity or it's very acute. We'll then also talk about the traditional use of balloons to dilate stenotic coronary veins, and we'll also learn that you can use balloons to make a small vein larger and then put the lead into that previously small vein after you've dilated. From there, we'll cover the frequently overlooked topic of how to deal with some of the anatomic variants of the coronary sinus, and in particular, the persistent left SVC and CS atresia. Unfortunately, not all the patients read the textbook, and not all coronary sinuses are the way you'd like them to be. So it's important to understand that there's a lot of variation in the coronary sinus, and these are some of the things that you're going to run into. So it's good to know about that. Next, we're going to show how to make the dreaded right-sided implant, CRT implant, simple. And then finally, we'll cover whether the Jerdheim LV endocardial technique as an option for CRT. So you can see there's a lot to cover. The nice thing is that when you embrace process optimization, as we describe here, and learn to use these interventional tools and techniques, you start to look forward to CRT because you know you have the tools, you have the power, you have the ability to be successful. And there's nothing more gratifying than coming out of the room with a successful implant rather than feeling ashamed that you didn't get the lead in for the patient. So I think you'll find this session very useful. There are narrated videos on my website, byvtips.com. Be careful, there's a YouTube channel called byvtips.com as well. In the YouTube situation, things aren't organized very well. But on the website, things are categorized by topic. So for example, there's a section on orthodromic snare, there's a section on antidromic snare, there's a section on CS anomalies, there's a section on fibroplasty. So you can look through these various sessions, and there's usually an annotated or a narrated video that can give you some ideas and potentially make things easier for you. You can always look it up in the middle of a case if you're having a lot of trouble. So thank you very much, and let's get started.